Now, the next journalist on the line is Pranay from ABP News in India. Pranay, are you on the line?
Yeah, I am online. And my question is to panel that, India is seeing a surge of the cases right now. You pointed out about the aggressive testing and the aggressive strategy in this match against coronavirus. How do you suggest and what is the WHO's observation about the situation in India? And there is a shortage of kits. So how WHO is going to help the second most populous country on earth?
So this is a question that we receive from a number of countries that are really facing some increasing case numbers. And the questions are around how do we best use the resources that we have. So we've been very clear in our messaging that, to fight this, we really need to find all of the cases. We need to know where the virus is so that we can tailor our approach to the areas that need it most. And to do so, we need to find the cases. So we need to be testing the suspect cases and testing those contacts who develop symptoms. When the situation gets when the outbreaks become large and resources become limited, we have recently put out some guidance around how to make some choices about where testing can be used, first and foremost, to really understand where that outbreak is, to find patients who are most severe so that they can have treatment. And I wanted to, this binder here is our binder of guidance that we have put out, that we have developed. Our first package of guidance came out on the 10th of January. And since then, we have been working across the globe with all of our member states, our regional offices, people working in labs, clinicians, IPC specialists, modelers, to try to tailor our guidance to best support countries according to the 4 Cs, according to if they have no cases, if they have sporadic cases, if they have clustering of cases, and if they're facing community transmission. And what we're trying to do through our guidance, and we need you to look at the guidance in full. Our press conferences are ways in which we can highlight some of these key aspects to our guidance, but the real detail is what's online. We know not everybody is going to read that, but those that do need to read that, who are taking decisions in countries, please look at that in full, because we have detailed information there that can provide and help you make decisions to make a tailored approach, all with the goal of suppressing transmission and ending these outbreaks. But there are some decisions that may need to be made in certain countries where resources are scarce. At the same time, we are working very hard with manufacturers who are developing test kits and the supplies, the supporting supplies, to be able to use those test kits. We are working with countries to increase the number of labs that can actually run these tests. So there's a multi-pronged approach in terms of how we can support countries through our regional offices and our country offices to build and increase that testing capacity.
If I could just possibly add specifically on India, obviously India, like China, is a hugely populous country, and the future of this pandemic, to a greater extent, will be determined of what happens in very large, highly populated, densely populated countries. So it's really, really important that India continues to take aggressive action at the public health level and at the level of society to contain, control, suppress this disease and to save lives. India led the world in eradicating 2 silent killers, or eliminating them in the country. Smallpox, one of the greatest successes of mankind, a virus that killed more people on this planet than all the wars put together. India, through targeted public health intervention, ended that disease and gave a great gift to the world. India also eliminated polio, another silent killer, and did a tremendous job on surveillance and finding cases and vaccinating and doing all the things that need to be done. So India has tremendous capacities. All countries have tremendous capacities. When communities are mobilized, when civil society is mobilized, when, as the Director General says, heads of state and governments drive an all of society approach. There are no silver bullets here. There are no easy answers. If there were, we wouldn't be having to work so hard. We've got measures we can take now while we wait for other solutions, and we must take them now. So it's exceptionally important that countries like India lead the way and show the world what can be done, and do as they have done before. Show that aggressive, sustained public health action from community right the way through to head of state can have a profound effect on the trajectory and the outcome of this pandemic.